CNS stimulants. CNS stimulants excite the central nervous system. There are different types of CNS stimulants. There are anorexiants, amphetamines, and analeptics. They're approved for ADHD, narcolepsy, and respiratory distress reversal. ADHD is a neurotransmitter regulation problem, usually apparent prior to 7 years of age, more common in boys. Inattentiveness and inability to concentrate, restlessness, hyperactivity, and inability to complete tasks and impulsivity are things that typify this disorder. Narcolepsy involves recurrent attacks of drowsiness and sleep during the daytime, unable to control sleep. So sometimes people will fall asleep while driving, talking, eating, and standing. Amphetamines. The action of amphetamines is that they release norepinephrine and dopamine. So that norepinephrine, remember, is on the sympathetic side. Norepinephrine is adrenaline, and dopamine is kind of an extension of that, if you want to think of it that way. Side effects and adverse reactions include tachycardia, palpitations, hypertension, sleeplessness, restlessness, irritability, anorexia, dry mouth, weight loss, diarrhea, and impotence. So, amphetamine-like drugs do the same thing, right? So we call them amphetamine-like, but many people continue to call them amphetamines. So we look at dexmethylphenidate, which is also called Focalin, or methylphenidate, which is pretty famous, called Ritalin. They increase attention span and cognitive performance. They decrease impulsivity, hyperactivity, and restlessness. Narcolepsy is treated with methylphenidate, or Ritalin, or modafinil, or Provigil. Action's not fully understood with that one. It increases wakefulness. It decreases episodes of falling asleep during the day and or working hours. So there are certain side effects and adverse reaction of Ritalin and Ritalin-like drugs. They include tachycardia. You can see that here on the screen. It's a fast rhythm there. Palpitations, dizziness, hypertension, sleeplessness, restlessness, nervousness, tremors, irritability, increased hyperactivity, anorexia, dry mouth, vomiting, diarrhea, weight loss, and thrombocytopenia. And you're saying, well, this really does help to release dopamine. So there are components of this that you're going to see that don't all fit on that sympathetic side. So Ritalin, Adderall, advice for parents, patients. You want to give people advice and teach them about their medications. And so this is what you'd want to do. Tell them, give these prior to food. These medications will decrease appetite, so that's really important. Report any palpitations or irregular heartbeat. Record height and weight. Give these early enough in the day so as not to interrupt sleep patterns. Parents are in charge of this medication. These are controlled substances, and patients will need to be seen by a practitioner before they can be renewed. So parents need to know that and plan for that. Avoid alcohol and caffeine with this medication. Do not stop abruptly. And taper with practitioner guidance. People taking this can chew gum to help their dry mouth with this medication. Anorexians. So anorexia, by definition, is basically a decrease in appetite. So anorexians include these things that decrease appetite. Didrextenuate Suprenza, also known by benzamphetamine, diethylpropion, and phentermine. The side effects of these are nervousness, restlessness, irritability, insomnia, heart palpitations, and hypertension. Analeptics. So analeptics kind of sit in a category of their own. These are things that stimulate respirations in newborns. Theophylline and caffeine are actually classified as analeptics. Side effects include restlessness, tremors, twitching, palpitations, insomnia, diuresis, tinnitus, nausea, diarrhea, and psychological dependence. DOXAPRAM, or DOPRAM, is used in respiratory depression. Its onset, so remember when we talked about pharmacokinetics and we're talking about the peak, the duration, the onset. So here's an onset. Onset, 20 to 40 seconds and peaks within 2 minutes. So it happens pretty quickly. Side effects include hypertension, tachycardia, trembling, and convulsions.